Thanks very much for participating in our study. Before you get started, we need to review some important points about navigating this survey. Unlike most websites, in this survey, once you advance past a page, you won't be able to return to it to review information or change responses. So we ask that you please make sure you are happy with your responses and read or listen carefully to all instructions before you move on to the next page. If you need to take a break and return later, you can do this simply by returning to the survey's web address, the same one that brought you here in the first place. You will automatically start where you left off with all of your progress saved. If you do need to leave, however, we ask that you please finish whichever exercise you're working on first, while it is still fresh in your mind. In this study, we are interested in how video-based rating exercises can be used in the summative assessment of paramedic trainees. Your job will be to watch video recordings of primary care paramedic trainees who are preparing for entry to practice certification as they participate in simulated emergencies. You'll then be asked to rate and comment on their performances for the purposes of summative assessment. This means that your job is to help determine whether the trainees demonstrate expected or mandatory competencies. All 3 trainees are at the primary care paramedic entry to practice level, are at the end of their training, and are preparing for entry to practice certification testing. You can assume that your ratings and comments will inform decisions about whether or not the trainees are ready for independent practice. After some brief instructions, you'll participate in 3 rating exercises. Each exercise consists of a video of a trainee participating in a simulated emergency, followed by a rating exercise in which you will rate and comment on the trainee's performance. Each video depicts a simulated scenario. This means that everyone besides the trainee is acting out a planned scenario from a script. However, the trainee, whom you will be observing, is not acting from a script, and is expected to perform as if the scenario was real. Each video depicts a first responder, the trainee, responding to a call for assistance from a transfer company who is transporting a patient from one hospital to another. En route, the patient had become unstable and presented with a decreased level of consciousness. As you will see, the trainee enters the scene shortly after the video recorded scenario starts. You will be able to identify the trainee by the highlighted circle around his or her head. Upon entering, the trainee is presented with a patient in VTAC who deteriorates to cardiac arrest at a scripted time, regardless of intervention. As in a real scenario, the trainee is expected to assess and manage the patient, enlisting the assistance of the 2 staff from the transfer company as needed. The transfer company crew is scripted to have different levels of ability and willingness to help, and will be in conflict with each other throughout the case. You will be able to see the patient's ECG and heart rate superimposed at the top of the video screen, their respiratory rate on the bottom right, and blood pressure on the bottom left. Each video is 9 minutes long. On the same page as each video, you'll see a series of rating scales you can use to rate the trainee's performance. Each scale represents a different category of performance. For each category, there is also a comment box, where we ask that you provide comments that would be useful for the assessment purpose. When you provide comments for your rating in each category, you can address specific aspects of performance, overall performance in that category, or both. Each category is accompanied by a definition, as is each rating level. We ask that you please review the definitions for each category and rating label carefully before watching the video. This will help you to know what to pay attention to during your observation. Also, before you select each score and make each comment, be sure to check that the rating label definition matches your interpretation of the performance for that category. It would also be good practice to do this again for all items before you move on to the next page. After you complete all of the scale items and provide input in all of the accompanying comment boxes, you'll be asked to advance to the next page. If you have not completed these items, you won't be able to advance. After you've finished your rating of the first trainee and move on to the next page, you'll be presented with exactly the same exercise, but this time you'll be assessing a different trainee. Once you've completed this second exercise, you'll move on to the third and final video, showing a third trainee. We ask that you try to think of these three trainees' performances as independently as possible. Do your best to avoid comparing them to each other, focusing just on the trainee in front of you and the criteria we've provided you to assess them. Lastly, please remember that your job is to provide a summative assessment that can be used to inform decisions about whether or not the trainees are ready for independent practice. Please assume the scores and comments you provide will be used for this purpose. Once you've completed all three rating exercises, we'll return with a short video to guide you through the last component of the survey. See you then.